much. So is it as scary as they make it to be? Are we dealing with this triple threat?
Well, I would prefer to talk about it rather than a triple demic. I'd rather talk about this as viral respiratory season, or cold and flu season is a little bit easier to say. And what that really means is we actually are not dealing with just those three viruses. We're dealing with a whole bunch of viruses that like to transmit at this time of year. They like the cold, dry weather. They like when people are getting together indoors, especially in indoor, poorly ventilated, crowded spaces. And that's when they like to transmit. And so every year we see increases in viruses like RSV, like influenza, but also so many other viruses. We've got para-influenza, coronaviruses, rhinoviruses, all of the viruses that cause the common cold and what people describe as the flu, even though they're not necessarily influenza. And so these all tend to transmit more in the wintertime. And what we're seeing right now is, number one, we of course have a new player in the game, and that's COVID-19, which has only been with us for the last 2.5 years. But we're also seeing some of those other viruses transmitting more than they have in years past. And there are a couple of reasons for that. Number one, for the last 2.5 years, people were wearing masks and distancing and staying home and doing all these things that prevented viruses from transmitting. And a lot of that has gone away. And we've also got very young children who have never before seen some of these viruses. So their immune systems are a little bit less mature, and they are the ones who are right now experiencing the worst outcomes with viruses like RSV.
Absolutely. So we know what COVID is, or we have an idea because we've been experiencing it. And then, the flu has been around for so long. What's RSV?
So RSV stands for respiratory syncytial virus. And it's a virus that has also been around for a very, very long time. It's just that we haven't heard about it so much. And usually in healthy adults, it causes mild cold-like symptoms. So not something that you would necessarily be tested for, not something that you would necessarily receive treatment for other than your over-the-counter Tylenol, Advil, drinking some hot tea at home. But again, we're hearing more about respiratory syncytial virus right now because some of those young kids who have never before experienced it, those are the ones who are more likely to have severe outcomes. And in younger children, that's when we see it causing issues like what we call bronchiolitis, which is
Mhm.
inflammation of those very small airways, where they can end up wheezing with respiratory distress, needing to have some additional oxygen. And so what we've seen in the current surge, which is a little bit earlier than we see in typical seasons, what we are seeing is that it is predominantly affecting children under the age of 4.
How serious is that?
Well, again, if someone is healthy and has a good immune system, if they're a little bit older, if it's a child who is in their, 10 years old or in their teens, again, it may be very mild. It may be just a mild cold with a runny nose and a little bit of a cough. But in those youngest children, in those pediatric cases, that's when we can actually see that they need supplemental oxygen, that they need breathing treatments, sometimes steroids, sometimes admission to the ICU, and even death. So we really worry about the youngest who are affected with RSV. And then we, of course, always with these viruses, they can affect people who are older and who are immunocompromised and have other medical conditions as well. So for people who are relatively young and who are healthy, this may not be a big deal, but it's really those extremes of age that
Mhm.
we worry about this causing severe problems.
Is there a vaccine for it?
There is not a commercial vaccine yet. There are vaccines that are undergoing trials that are being studied and that have shown extremely promising results. So hopefully there will be a vaccine soon.
Absolutely. What's the we don't want to not talk numbers, but what's how is the COVID-19 behaving? Do we see increases? And what's the expectation for the fall?
Well, we are right now in a relative plateau. So things have been relatively stable, which is good news for the fall. In previous falls, we saw cases go up when schools open. We didn't really see that this year. But again, number one, we are looking at potential upticks in the wintertime. It's a virus that loves when people are indoors. And so as soon as the weather gets really cold and people completely move indoors, that's when we can expect to see an increase. But with COVID, one of the things that we are especially worried about are some of the variants of concern. And there are two variants of concern in particular that are on the rise. And one makes a medication called Evusheld less effective. And this is a medication that is used for people who are immunocompromised to protect them. It's long-acting antibodies. And there's another variant that is impacting our use of monoclonal antibodies that are used for treatment. And so with the rise of both of these variants, we're losing some of the therapeutic tools that we had in our arsenal against them.
Does the current booster that we have and we're taking, does it protect us from these two variances?
So the current boosters are really designed to protect us against not only that original strain of COVID, but also the variants that are circulating right now, the BA4 and BA5 variants. So the bivalent booster is an excellent tool, but I have to say that uptake of this tool hasn't been as good as I had hoped it would be. People are getting this bivalent booster, they're taking it, but not with the numbers that I had really hoped to see. We know that this cold and flu season, this viral respiratory season, is putting a lot of demands on our hospital. And we've got to use these tools in order to protect our hospital capacity so that if someone has a heart attack or a stroke or is involved in a motor vehicle accident, they have access to the excellent care that they deserve.
Yeah. I know we talked about this so many times. I want to talk very briefly the benefit of taking the vaccine, not only for us, but also for the people around us.
Absolutely.
Just like a reminder. I know we've talked about it for 3 years.
Yeah, the vaccines are the best tool we have at protecting against severe illness and death. So taking the vaccine is not only protective for yourself, but again, we're using these tools to protect our healthcare capacity. We want to make sure that we have enough hospital beds to take care of those who are ill with other things, and that they're not only taking care of patients with COVID. So protecting healthcare capacity, and also we know that the vaccines don't completely stop transmission, but they can reduce the amount of virus that you're shedding. They can reduce the amount of infectious load or infectious risk you're putting at those around you. And there are some other tools as well that I do want to point out that we are forgetting about as we enter year 3 of this, of living with COVID. And those tools are things like staying home when we're unwell, not sending our kids to school when they're feeling sick. If you are feeling unwell and you live with people in your home, wearing a mask is another way to protect them. Over-the-counter tests are a really good way to test for COVID early and again, protect those around you. And then we still do have therapeutics available for COVID-19 and even for influenza, oral medications that you can take. And so talking to your doctor ahead of time to see if you do get sick, are you a candidate for those medications? And that way you can plan ahead.
Absolutely. Now, are we expecting a worse flu season this year? And how is maybe it's too early to tell, how is the vaccine really going to counter that? Do we know?
So the early signs are that the vaccine this year for flu is matched pretty well against the strains that are circulating. So that is good news. But when we look at our data, we're not seeing a whole lot of cases of flu yet. What we are seeing, though, is another piece of data, and that is our wastewater surveillance. So we do wastewater surveillance for a variety of things. And the wastewater surveillance told us that RSV was coming. And it's also telling us that influenza A is likely on the increase. And so, again, this is a really good time to get your flu shot. You can get it with the bivalent booster. You can do it on the same day. When I went in, I got COVID shot in one arm, flu shot in the other arm, and rested for a day, and then I felt fine. So this is a really good time to get vaccinated for yourself, for your loved ones, just to make sure that we have a safe and healthy cold and flu season.
Absolutely. What are we doing on the state level to really educate people and to provide help to everyone?
Well, number one, conversations like this. So I love coming on your show and talking to your audience and telling them about some of the resources we have available. We continue to put out information on our website. We send information to our clinicians around the state so that they know what the trends are, they know what viruses are on the upswing, and really making sure that we've got these channels for communication, I think is the best thing we can do right now.
Absolutely. Now, with Thanksgiving coming up and more people going to be together, wouldn't it be, prudent for us to 2 weeks before take the vaccine?
That would be optimal. I think getting vaccinated as soon as you can for both COVID and flu is a good way to protect yourself, protect your family members. During Thanksgiving, there are some additional things you can do that will also keep your gatherings a little bit safer. So making sure you've got a well ventilated space. You can also ask your guests or yourself to test with one of those over the counter tests. And just a reminder for your listeners who are in the state of Michigan, our Michigan health insurance plans are required by law to provide 8 free COVID tests per person per month.
Per
So
month?
it's a
Okay.
good time to also stock up on those tests and have them at home. And then when you have a gathering, if everyone's testing, you're really reducing your risk at
Ab-
that event. But of course, vaccinating ahead of time is really, really important as well.
Absolutely, absolutely. And are you concerned that, for 2 or 3 years we've done really well with masks, washing our hands and taking all these measures, and all of a sudden people are abandoning all of that? Are you concerned about that? I mean, seems like this could contribute to the mess that we may end up in.
Absolutely. I think it's so tempting to say, I'm done with COVID. I'm moving on. I don't want to think about this again. But there's some really basic things that people were doing a good job of, and I don't want to lose that. And first is hand washing. So hand washing and carrying that little bottle of hand sanitizer, don't stop doing that. That's still a really good idea. And then the other part of this, of course, is keeping folks home when they are sick.
Yes.
One of the things during the pandemic was if you were in a grocery store and if you sneezed or coughed, everyone would move away from around you. No one wanted to be near someone who was coughing and sneezing. And so I think that was pressure. It was pressure to stay home if you're not feeling
Yeah.
well.
Yeah.
And I don't want people to feel like it's okay now to go to work, to go to school if they're feeling sick. And it's important too, if you're feeling sick, even if your COVID test is negative, stay home.
Yeah.
Stay home or wear a mask because there are other viruses circulating right now.
Absolutely. This really has nothing to do with the flu, but it seems by us staying home for 2 years or 2.5 years, our bodies may have not gone exposed to other viruses that normally are, no big deal. Should we start doing it slowly so we can get exposed and build the immunity, or are there any concern for any certain viruses that, that may come out?
I think just really taking a common sense approach to this is the best thing to do right now. So yes, many of us have not seen those viruses for the last couple of years. And so our immune systems are playing catch up, but also some of us are not used to that feeling of being sick. And we had forgotten how terrible it is to have
It
a
is.
cold,
Yeah.
and all those things that you have to do when you're feeling unwell. So the first thing is, I think if you do get a mild cold and you're otherwise feeling well, it's okay to stay at home and take a COVID test. If that COVID test is negative, you can do the things that we're used to doing. Take some Tylenol, take some Advil, drink some hot tea with honey, do all those things that we've gotten out of
Exactly.
practice doing.
Exactly.
Um, and then, of course, those same other mitigation strategies. So, washing your hands really well before you eat or after you leave a restroom. If you're going out in public, we know that there are all kinds of germs and viruses on door handles and things like that. So, keeping that bottle of hand sanitizer with you is a really good idea as well. But lots of things that you can do to still go out in public, enjoy your life, but also try to stay safe and healthy while you're going about your day-to-day activities.
Absolutely. Is there anything I haven't asked you that people need to know?
I think you asked me pretty much all of the questions, but I'm wondering if I could just remind your listeners
Sure.
about the tools that we have available because
Okay.
I want to drive this message home. So the first bucket, I divide these into buckets. The first bucket is to make sure that you're up to date with vaccines and boosters. So we have a vaccine for influenza, we have a vaccine for COVID. Make sure you're up to date on those vaccines. The second bucket are these mitigation strategies. So staying home when you're sick, washing your hands really well, covering your coughs and sneezes if you are coughing and sneezing, or wearing a mask if you are around others and you're feeling unwell. Next is having a supply of over-the-counter COVID tests at home. If you're feeling unwell, it's always good to take one of those COVID tests. And if it's negative, you can always repeat it. You can repeat it a few times just to make sure it's not COVID. But again, if you test negative for COVID, it could be something else. So we still want you to stay home. And then
Absolutely.
lastly, those therapeutics and talking to your doctor to see if I get sick, am I a candidate for therapeutics for COVID or influenza? And really just want to remind your listeners to stay safe and healthy.
Thank you so much, Dr. Natasha Bagdasarian. She's the Chief Medical Executive with the state of Michigan. We thank you so much for taking the time to be with us. Stay tuned. We're going to take a short break.